the Democratic Nursing Organization of South Africa has warned of rolling mass action if outstanding salaries are not paid this week. Trainee nurses in Gauteng haven't been paid for several months now. Newzroom Afrika's Mohlaoli has the story.
All dressed up, with no means to go anywhere. The Gauteng Health Department hasn't paid 1,000 nurses in training for 4 months now. Those who can afford to have been reporting for work despite the situation, but many say they can't afford transport costs due to rocketing fuel and public transport prices. Basic hygiene and food items are also out of reach for many. For these trainee nurses at Edenvale Hospital, life is unbearable.
I get calls on a daily basis from nurses that are currently doing their ComServe and those that have just completed their post-ComServe. People don't have toiletries, people don't have food, people they are being chased out of their places where they are renting because landlords cannot take it anymore. There's excuse after excuse.
The Democratic Nursing Organization of South Africa has drawn a line in the sand. It's threatening a nationwide strike if payment isn't made in coming days.
One thing that saddens us and that actually pisses us off is the fact that these nurses have been, rendering services for the Department of Health without being paid. Now, what type of a government that doesn't pay, young people who have just joined the profession? These people are expected to be caring, but they are not taken care of. So that is why we have called this briefing, because on numerous occasions, after our engagements, we had commitments that they would pay them. But when we go and communicate the outcomes of those meetings, the department would not follow through, in the process compromising the union called Denosa.
Denosa says it has the support of sister unions in the health sector. It adds that the situation is no better for registered and enrolled nurses nationwide.
The department, ever since the termination of those COVID-19 contracts, and even with the current cohort of nurses, has been spending more money on agency nursing. Now, if the department can afford to get agency nurses in there, it means that there is money to pay the current cohort of employees who have not been paid.
Nurses are classified as essential services by law and can't embark on full-blown strike action. Meanwhile, the Gauteng Health Department has released a statement on Sunday afternoon saying all affected nursing healthcare workers will be paid and employed on a full-time basis within the following week. For Newzroom Afrika, Channel 405, I'm Tumaole Mohlaoli at the Edenvale Hospital.